Welcome to my channel. My name is Maxilo. So today I'm going to be talking about pneumonia. But before I talk about pneumonia, let me just do something. I did a survey like for the past 2 weeks. I was asking people whenever I come in contact with people, I ask them, please, can you tell me what's the cause of pneumonia? And do you know the response I got from these people? They told me, all of them told me that the cause of pneumonia is cold. Meaning when you lie, they will tell some of them will tell you that when you lie on the floor and it is cold, or maybe when you stay in front of a fan and the thing is blowing very well, you not get pneumonia. And I just feel that this is a concern to me because the essence of us being a doctor is not just to go to the hospital, but also to educate people on certain conditions so that they will have an idea of such condition. So I have decided to come and educate us today on pneumonia. All you have to do, please, is to subscribe. That is the encouragement you give to us, is to subscribe, share this video, and drop a comment, right? Pneumonia is the inflammation of the lungs, and it is associated with the lower respiratory tract. Now we have the upper respiratory tract and we have the lower respiratory tract. The lower respiratory tract, which pneumonia is associated with, is the trachea, the bronchi, and the lungs itself. Okay, and now pneumonia can be classified into different segments. It can be classified based on the source of infection. It can be classified based on the microbia, that is the organism causing it. It can be classified based on the anatomy. Now, based on the source of infection, we have community acquired pneumonia, we have hospital acquired pneumonia, or you call it nosocomial pneumonia, we have um, aspirated pneumonia, and we also have ventilator associated pneumonia. Based on microbia, we have virus, we have bacteria, we have fungi, and we have um, parasitic pneumonia that is caused by parasite. And based on anatomy, we have lobular pneumonia, we have bronchopneumonia, right? I hope we are all getting this information. So I want to be explaining each of those words, all right? Each of those classification. Now we are going to talk about community acquired pneumonia. Now, when we talk about community acquired pneumonia, we are trying to explain that this pneumonia it is cutting outside the hospital, meaning in the church, in the club, like in wherever that anywhere that is outside the hospital. That is why it is called community acquired pneumonia. Then let's talk about hospital acquired pneumonia. Hospital acquired pneumonia simply means that this pneumonia is gotten in the hospital. Once you are admitted, maybe at 48 hours after you be admitted into the hospital, you start having this pneumonia, meaning it is gotten from the hospital. And now we now have the aspirated pneumonia. Now, when the word aspirated means you take in something, right? Now, it can be fluid, it can be food, it can be anything that contain bacteria, right? Now, normally when you take in something into your body system, it goes to your esophagus down to your stomach through your mouth, right? Now, sometimes people might have condition that affect their that affect swallowing. That maybe they have a swallowing disorder, or maybe they have stroke, some uh, muscular disorder. Now, these people might have issues with their swallowing process, and in that case, they might swallow this stuff into other parts rather than through the esophagus down to the stomach, right? They might swallow into their trachea, into their lungs. And now this thing that they are swallow might contain bacteria or whatever, might contain organisms which when it travel to that place instead of the stomach, it can infect the lungs, right? Now we have the ventilator associated pneumonia. Maybe when they add a a endotracheal intubator, maybe an intubator, through that process it might get to your lungs. Maybe infected, it might get to your lungs and you get this infection. So meanwhile, now this community acquired can this community acquired pneumonia can have sources, right? It can be inhalation, meaning you inhale it. This inhalation can be person to person, maybe when two-person is looking at each other, right? When they sneeze, right? If someone is infected, it can pass it to the next person. And remember, this stuff is airborne. That means it can travel in the air and people can inhale it. Another source is that it can be hematogenous, right? It travels through the blood. Just imagine some part of the body is infected and this infection passes through the blood. It might get to the lungs and the lungs might be infected. Let's talk about some of the organisms or some of the bacteria or virus that can cause pneumonia. Now, the most common one is Streptococcus pneumonia. We have Streptococcus pneumonia. We have Haemophilus influenza. We have Mycoplasma pneumonia. We have Chlamydia pneumonia, and we have Mycobacteria. Remember, some pneumonia can be reactivated, can be a reactivated pathogens, that means reactivated organism, which can also contribute in the formation of pneumonia. Since we've gotten an idea of what pneumonia is, now let's talk about the clinical future. That means how can you know that this is pneumonia, this person have pneumonia? Number one, fever. Fever is not a disease. It's a clinical manifestation that something is happening in the body. Maybe your body is trying to fight off an infection and fever comes as a feature. Now we have rigor. Rigor is like an episode of sudden intense shivering as a result of increase in temperature. Now we have anorexia. You lost appetite, you don't even have interest in eating anything, you've lost appetite, reduced desire to eat. So it can be a clinical feature. Another feature is pyrrhetic chest pain. Now, this pain is stabbing, it is sharp, and it is worsened when you take a deep breath or you cough. You feel that pain. Tachypnea. That means you have a rapid breathing rate. So if you see any of this feature, headache, cough is there. If you see any of this feature, please take yourself to the hospital.